everybody. We're so excited that you could join us today. Sue Salmon was supposed to present today, but she had a family emergency. And I am really thankful to Dr. Celestial and Kate Golick because they were ready to step in and do their lecture today. I'm really excited about the feedback we've been getting from this series. So I don't want to use up any more time, but thanks for joining us. And I want to mention Kate and Alice have FTE time at our College of Nursing at Ohio State. They are academic program directors, and their charge is to make sure our faculty are integrating wellness throughout their curricula, helping our staff do that as well. So Kate and Alice, thanks for pitching in today.
Okay, hopefully y'all can see my screen and can hear me. It's always a good thing to just kind of double check. So thank you, Bern, for getting us started today. And hello, everyone. As directors of wellness academic programming, like Bern had just said, at the undergraduate and graduate level, my colleague Kate Golick and I have prioritized strategies that promote and enhance student health and well-being within the college's Livewell framework. And so there's a note here on the slide about what that means. To lead and innovate, have a vision, and execute wellness-focused, evidence-based curricula to support our students in becoming lifelong learners and lights for the world. Our wellness focus of this Live Well framework is certainly a priority. And those of you logged in today, wherever you are across the country, you are aware, I know you are, of the need for wellness in our populations. 1 in 2 adults have a chronic illness, 1 in 5 adults have a mental health illness, and less than half receive treatment. And this mental health crisis extends to college students. 30% of college students ages 18 to 25 report having a mental health disorder, and that was pre-pandemic. So since the pandemic, about 75% of students who have a mental health diagnosis have some type of crisis on campus. The prevalence of anxiety has risen to above 50% in college students. Health science students experience the stress of college education in addition to the stressors of clinical practice. And I know in these first few webinars, we talked about clinician wellness and about the challenges for clinicians. For our health science students, the impact of the pandemic includes change in their work hours, financial stress, changes in their nursing programs, changes in their ability to complete clinical hours. And so for them, finding this balance in managing stress and developing resilience has been difficult. And it has led to lack of sleep, physical inactivity, and health and wellness risks. Innovative strategies are absolutely increasingly needed to respond to this national epidemic of student and clinician burnout and distress. We know it negatively affects health. We also know that it negatively affects the quality and safety of healthcare. So we've been called on as leaders and as educators to prioritize the overall well-being of clinicians and of our learners, to resolve system issues that lead to burnout, to create wellness cultures, to provide evidence-based academic wellness programming. And the questions on the slide are important. How do we do this? How do we prepare clinicians to prioritize wellness? How do we get people ready to function well in a transformed healthcare system? What can we do to create cultures of wellness within our universities, within our communities? I do think that our Big 10 webinars have highlighted strategies to address this call to action. I'm really glad that they've been well received, because here's the thing, we can do this. We do this as directors of academic programming, but every person plays a role who interacts with our students, with clinicians, with educators. So an exemplar of how we've shifted this paradigm is our telehealth wellness hub and wellness partner program. And so I'm going to talk a little bit how using this Livewell framework led to these initiatives. We formally started the Telehealth Wellness Hub as the pandemic began, as a way for our students to support the wellness of other students and clinicians to connect with each other. The specific aims of our Telehealth Wellness Hub are listed on this slide. We've had 4 major initiatives that we've implemented under the umbrella of the Telehealth Wellness Hub since its inception. Our initiatives, they're listed on this slide. They've included an emotional support line for nurses working in COVID-19 hotspots at the start of the pandemic. We had 14 faculty volunteer 220 hours of time to create a warm line for nurses at the start of the pandemic. We've had CARES funded initiatives that include an opportunity for nursing students and faculty to complete wellness assessments, and they have done so for more than 300 students across our main and regional campuses. And those wellness assessments have actually led to about 198 referrals for additional wellness support. Our student wellness coaching efforts have resulted in more than 1,500 clinical hours of practice for our DNP and NP students over the last 2 years. And all of those clinical hours have been completed virtually using telehealth. So what I would like to talk to you about in terms of this exemplar is a little bit more about the implementation and outcomes of our wellness partner program specifically. Because I do think that this is something that can be replicated in clinical practice and in our educational programs. So we first implemented the Wellness Partner Program during the summer of 2020. Nurses working in COVID-19 hotspots across the country were paired with graduate students. And our students were prepared. They understood wellness content. They understood the basics of wellness coaching. They practiced with a peer to provide wellness support. And then they had faculty and preceptor support. So what we did in the wellness partner program, is that we paired student coaches with nurses, and they met 6 to 8 times over a period of about 2.5 to 3 months. So that we did this during a summer semester. And during the sessions, the nurses were provided support for establishing self-care and for wellness goals. So they met by Zoom. Now we actually use Doximity as well. During that summer, partnerships were implemented for 188 nurses. They were coached by 49 APN students. And in our program evaluation, what we found is that 97.3% of nurses shared that they actually engaged in self-care and wellness during the program. And almost 95% agreed or strongly agreed that the initiative actually helped them improve their health and well-being, which was huge because this was a time when we were seeing increasing rates of stress and burnout in our clinicians. There's a quote on this slide, and I know it might be small font for you, but what I want to say about it is this, that the feedback we got from the nurses was they really felt like this Nurses Helping Nurses initiative meant a lot to them. We got positive feedback from the students as well, and we continue to get positive feedback in all of our initiatives of the Telehealth Wellness Hub and Wellness Partner Program. We really have re-envisioned clinical education to include wellness support. More than 325 nurse practitioner, DNP, and pre-licensure students have had an opportunity to use telehealth now to support wellness for critical care nurses, for clinicians working across the country, for students enrolled in our rural extension campuses, and for undergraduate students across other disciplines. One of the things in terms of lessons learned that I want to highlight, two things today, but one is the students learned to focus on 5 key health behaviors, because a lot of times they were like, what do we talk about? But what we did was went back to the basics of saying what matters in terms of wellness support, in terms of health and health promotion. So students learned the 5 key behaviors to discuss: eating 5 fruits or vegetables a day, having 30 minutes of physical activity 5 times a week, drinking alcohol in moderation, if at all, avoiding tobacco, nicotine, smoking, and sleeping 7 to 9 hours a night. So they kept the conversation simple. And they asked about goals in terms of providing wellness support. But here's the key that we learned. It wasn't so much what they said, it was the connection that made a difference. So more than any other lesson learned, we have found that the key to the success of all of these wellness efforts has really been social support, has been connection. Through these clinical initiatives, clinicians and students were supported to cope with stress, focus on self-care, and really enhance their health and well-being. So the Telehealth Wellness Hub is an example of a programmatic change. And now my colleague Kate Golick is going to talk about other course and clinical strategies that can impact the well-being of students using our Livewell philosophy.
Thank you so much, Alice. So that was a really great overview and exemplar of something that could be integrated into a program level. And now, like Alice said, I'm going to talk to you a little bit about courses and the clinical setting. And just as also to provide a wellness opportunity for you, if you are not already standing, I do invite you at this time to stand. You don't have to, but we have about 15 minutes left. And so it's just an additional 15 minutes where you won't be sitting. All right, next slide, please. All right, so Alice talked a little about our Livewell philosophy at the College of Nursing. And really what we try to do is then take that philosophy down to the level of the classroom. So this is kind of the roadmap of our Livewell classroom. So we try to encourage students to stand and move more. We try to encourage healthy lifestyle habits. So that can be something like even, in class, maybe encouraging things like water versus maybe a soda or some of the sugary coffee drinks that students get. Providing the students opportunities for self-care and stress management within the course setting, and even sometimes outside of the course. And then really to give that positive environment. So encouraging each other, promoting positive self-talk and teamwork with the students, and really having the idea of this partnership with them. And then working hard and partnering together to accomplish great things. Next slide. So one of the things that I came up with a while ago was this idea of lecture sizing. So taking either a lecture that you have in person, or this can be done asynchronous, and I've actually found it works really well asynchronous. And throughout the lecture, every 10 to 15 slides, encouraging the students to get up and do some activity during the actual lecture. So oftentimes I'll put a picture of like a beach you can see, and I'll put, all right, let's all, go for a quick jog and do a 30-second to a minute where, you're encouraging the students to stand up and walk. And I say, let's go walk on the beach. And oftentimes I'll put music on as well. Another one is, putting the song Rocky on and just saying, let's punch, so there's there's a lot of different things you can do with this. And then of course at Ohio State, our favorite is to dance in the shoe. So we put on Hey Sloopy and we all get up and dance in the shoe. All right, next slide. Another thing you can do is there's a lot of different ways, again, to incorporate activity into your lectures. This is just one example. Every 10 slides, have them do 10 reps of something. So again, this is not necessarily that conducive to the classroom setting. You can make it work, but it works very well for asynchronous lectures. But I call that the 10 for 10. We also do something here, and this is our second year that we've done this. We onboard our students. So we onboard them to wellness. And we've done this both at the undergraduate and graduate level, where their first course that they have, we do something called the Wellness Olympics. And so they're split at that time. We use clinical courses. So they're split into clinical sections, and we have clinical groups compete against one another. And so they have to track 4 wellness activities daily. So their minutes of sleep, exercise, their intake of fruit and vegetables, and then how many minutes they practice stress reduction. And then all those values are added up. And then the people who win, we actually award gift cards to. So it's been a really fun way to kind of incorporate a competition and to really instill wellness. And we actually did this with our faculty too this year for the first time, which was a lot of fun. All right, next slide. So this is another way that you can incorporate wellness. So I've done this now for many years where I've offered the students extra credit. And the way that I figured this out is that if I offer 0.2 points every week of our 14 weeks, it actually can never really change a grade. So this is something that students can participate in if they want to or not. It's considered totally optional. But either way, I'm not inflating grades by doing this. It's just giving them a little bit of incentive to participate. But what we do is we have them at the very beginning of the course identify a wellness goal. And then each week they have a very short wellness activity that they have to complete. So this can be anything from doing a guided imagery to taking a walk to trying a new healthy recipe. And what they have to do every week is just submit a Word document of what they did that week. So whatever the assigned wellness activity was, and then how they're doing on their goal. And we don't necessarily, we tell them at the beginning, we don't care how you're doing on your goal. You can say, I didn't do anything for my wellness goal this week. We don't care. It's just the fact that they're looking at it every week. Next slide. When I actually looked at the outcomes of this, so I looked at who actually achieved their wellness goal then over that period of time. And so you can see from the results, so the blue is actually something where they were able to achieve it. So they said, I achieved my wellness goal for the semester that I identified. And then the orange is they did not achieve it, but then the gray is they were close to achieving it. So you can see that the majority of people that participated really did stick with their goal, which is really great news. Next slide. We had extremely high participation rates, and we continue to have it. 95% of the students said they wanted to continue the activities. And then the other interesting thing is that 51% said they would still participate even if no extra credit was offered. So really showing that, students do want this and they do find it valuable. We also looked at this model in a cluster randomized intervention study. So we had the students do either wellness activities or we had them do a short activity on implicit bias. And then we kind of looked at the results of that. And we saw that the group that were doing the wellness activities, they did have the positive trends towards reducing stress and anxiety, whereas the other group actually had a downward trend. So we were able to improve those things just by doing these little micro activities focused on wellness. The other thing we found is we looked at their healthy belief scores, and it actually helped to improve that, the healthy lifestyle belief score as well. Next slide. And we will have time for a couple questions if you guys want, but just again, to kind of end on that positive note and that, give the positive teaching atmosphere. I love this quote and I always will. My teacher thought I was smarter than I was, so I was. And so I think, in the spirit of wellness, we're also doing this with wellness, right? So we're helping students to make better choices when it comes to their wellness. And hopefully that will also, transition with them when they go to practice. So that is all that we have today. So do we have any questions?
Kate, there's a question. Can you tell folks how much of a gift card we gave out to the winners of the Olympic Challenge?
Okay, so we gave $50 gift cards to our students that were the gold winners, and then 25, I believe. No, actually, it was 30 to the silver winners, and then to the bronze, we gave $20. Just help to incentivize them a little bit to do that.
The wellness onboarding piece is so critical on their way in to our programs because it sets the expectation. We do expect them to integrate wellness into their daily lives.
Yeah, and I 100% agree with you. And I think that, we include it in the courses, they have this immersion, and then being able then to actually take that and partner with someone and talk to them about their wellness. Like, to me, it's like each step of the way. So they come in, they hear it, they hear the priority, then they hear different dimensions, different areas. And then the graduate students leading how to implement this, I think it's fantastic. I also think those peer partnerships have really, the feedback we get from the students, it's like I'm an online students, online synchronous or online asynchronous. That additional connection to somebody who is also a student has really helped.
Other thing, just to kind of throw it out there too for faculty, I think that, it can be daunting to say, oh, one more thing. How are we going to put one more thing in here? And I want to emphasize, even in the examples that we gave, those things are very easy, to actually put into courses, and they don't take a lot of time. We also, at Ohio State, we have a faculty toolkit, a faculty wellness toolkit that is available to the public. So we can actually put that link into the chat, but that's just, again, some more ideas of how to incorporate wellness, mostly at the classroom and in the clinical setting, but it really is not a time-consuming process. And when you think really about, long-term, how this is helpful to the students, it's very well worth it.
Kate, I'm putting the faculty. So this question about the slides will be available with the recording on that site. And then I put the faculty wellness toolkit link in the chat.
And I'd like to add that Alice, Kate, and I, along with Student Life, we do a Livewell faculty series once a semester at our university. It's a 4-part weekly series where we teach faculty how to integrate wellness into their academic programs. It has been hugely successful. And although I'm biased as Ohio State's Chief Wellness Officer, I really think our colleges of nursing in particular can really reach the broader community like we've done here at Ohio State and really be seen as the leader of wellness on campus. Okay, any other questions? Kate and Alice, last words of wisdom from you, please.
Well, I guess I would just have to say that, with the strain of the pandemic and the stress that our students are put under, I would say, pretty much on a daily basis, I think as faculty, we have this amazing opportunity to kind of be a mentor and a leader for them and to show them different ways and strategies that hopefully will, like I said, transcend into whatever it is that they do in the future. And I think, that's a big responsibility of us as faculty, and we have a huge opportunity to really impact students at a pretty vulnerable time in their life.
And I think that the other message that eventually comes through to our students is this: you can be okay generally, but there are going to be tough days. So asking, are you okay today? That it's okay to not be okay. It's also okay to be okay. Do you know what I mean? Like either one. So we don't want to say you are definitely going to be stressed. So we want to normalize that sometimes nursing is amazing and being in healthcare is such a strength, and that there are also times where you're going to feel the stress or burnout. So either of those things are okay. The important part is the check-in. And that is going to be different for them in practice than the way I feel like that we were nurtured. But I think it's really so essential to their success to be able to really check in. And our feedback from our graduates is that this makes a difference to them.
Thank you, Kate and Alice, for a great presentation. Everybody spread the word about our Big Ten National Wellness Action Collaborative and join us for another great presentation next Wellness Wednesday. In the meantime, get up, take a recovery break, and stay well. Thanks for joining us today.